Next up, I am delighted to introduce Pat Kavanaugh from Delta Dental. Pat is an account manager with Delta Dental, where she serves as the key contact for Acera for account services, including implementing dental wellness benefits programs and servicing retiree member requests. How's it going, Pat?
It is going, and thank you very much, Mike. And thank you, everybody, for allowing me the opportunity to discuss good dental care at this point. Happy teeth, happy retirement, the art of prevention. And prevention is the key word here. Okay, I'm going to discuss preventative dental care for seniors. Oral health really means much more than healthy teeth. The mouth serves as a mirror showing information about other parts of your body, like systemic diseases and cancer. What are some of the dental risks as you age? Cavities. Cavities just aren't for kids. Per the CDC, nearly 1/3 of all adults between the ages of 20 and 44 have untreated tooth decay. Making or going to your dentist on a regular basis for checkups will help with the prevention of cavities, and also brushing and flossing on a regular basis will help with the prevention of cavities. The risk of gum disease actually increases starting at the age of 30. Obviously, good oral health care, your brushing, flossing, that will also help preventing gum disease. Dry mouth. A lot of us senior citizens are on medication, and a lot of medications will cause dry mouth. Your saliva, actually, the purpose of saliva is to wash away bacteria, food particles, and to help with the plaque buildup. With the dry mouth, you don't have that saliva. So that's just more areas where bacteria is going to grow and cause cavities and gum disease. So if you do have problems with dry mouth, try drinking more water or chew sugar-free chewing gum. And this will help your body to make saliva. Arthritis can also cause difficulty with brushing and flossing. You may want to use an angled toothbrush or perhaps a electronic toothbrush instead of manual. Again, healthy mouth, healthy body. Prevention is the key to take care of your teeth and your gums, which will improve your overall wellness. There are two dental problems. Number one, gum disease, which affects half of all adults, and number two, tooth decay, and which is most prevalent with chronic disease in children and adults. Now, what diseases can worsen if you do not have good oral health? Diabetes is one. Also, rheumatoid arthritis. Poor oral health has been linked to heart disease and strokes. And of course, poor oral health is also a factor with dementia. Let's look at the basics of preventive care. Number one, brushing, flossing, and three, regular visits to your dentist for your routine cleanings and exams. Why should you get a cleaning? Number one, you prevent cavities. Number two, you stop your tooth loss. The hygienist will actually remove the plaque and tartar buildup that you can't get rid of through just regular brushing and flossing. That will also help with the prevention of cavities and gum disease. And of course, it brightens your smile. Also, you can get rid of that halitosis. It freshens your breath. And number five, it will boost your overall health. Why get a dental exam? Your dentist may detect a systemic disease initially or early. There are over 200 systemic diseases that can be detected through a routine dental exam. Your dentist will also screen for oral cancer. They'll, they'll check your lymph nodes, check all around the inside of your mouth and your tongue for any telltale signs of the possibility of oral cancer. And this exam can also hopefully catch any signs of a systemic disease. I read at one point that 1/3 of the diabetic population in the United States is not even aware that they are diabetic. Diabetes is one disease that your dentist may be able to detect if you don't know that you already have it. Also, there is a correlation between gum disease and the possibility of heart problems and stroke. Okay, your plan also covers support for chronic conditions. You have additional coverage for one scaling and root planing procedure per quadrant per year. Quadrant is the location in your mouth. You do have with regards to your cleanings and your gum maintenance, your plan covers 4 per calendar year. And also, if you are diagnosed with the following diseases, we do have expanded coverage. If you're diagnosed with ALS, cancer, chronic kidney disease, diabetes, heart disease, HIV or AIDS, Huntington's disease, joint replacement, lupus, opioid misuse and addiction, Parkinson's disease, rheumatoid arthritis, Sjögren's syndrome, or stroke. If you have any of those conditions, you do need to enroll in the SmileWay program. You can do that by calling Delta Dental's contact center, and that number is listed on the screen here. It's also 888-335-8227. Please take advantage of this if you're diagnosed with any of the above mentioned diseases. Okay, what are some of the changes to your benefits which will be effective February 1st of 2024? Your plan year maximum is actually increasing from $1,300 per member to $1,900 per member. And that, like I said, becomes effective February 1st of 2024. And please know that with your plan, you are free to visit any dentist that you would like to seek services from. However, we do strongly recommend that you use an in-network dentist. Delta Dental actually provides you with 2 networks to utilize. We have our PPO network. The dentists in the PPO network have agreed to the deepest discount, meaning you're going to have less out-of-pocket expense, and your maximum dollars are going to be stretched further. You're also free to go to a dentist in our Premier network. We typically refer to our Premier network as our safety net. Just in case you can't find a dentist in the PPO network within your desired area, which is highly unlikely since Delta Dental does have the largest network nationwide. If you can't find a PPO dentist, look for a Premier dentist. There again, the dentists in the Premier network have agreed to a discount. It's just not as deep as the PPO, but you'll still be saving money. One thing to note, if you are going out of network, which you're free to do so, if you, and I'm going to use the routine cleanings, exams, and bite wing x-rays as an example. Your plan pays 100% regardless of what dentist you go to. If you go to an out-of-network dentist, your plan will reimburse up to a certain allowance. And that out-of-network dentist does have the option to balance bill you. So even though the plan pays 100%, you may get balance billed by that out-of-network dentist. Okay, we strongly recommend that you sign up for an online account. It's very easy to do. You just go to our website, thedeltadentalins.com, and create a username and password. Once you have signed on, you can check your plan details, and we have it that you can really drill down to see the eligibility, frequency limitations, etc. You can also check into your claims. We actually keep claim history for 7 years. You can view or print an ID card. I do want to stress, however, that an ID card is not necessary for proof of eligibility. We also have a cost estimator tool. You'll be able to use that tool. You go in and select the service that you'll be getting, and also select the dentist that you will be going to. And then our system will calculate what that procedure is going to cost. It will be based on your existing benefits. So if you already use some of your benefits, it will be based on what's left of your maximum. If you haven't paid a deductible yet and you are due to pay a deductible, it will also bring that up as well. Once you have an online account, if you have any questions, you're able to submit your questions to our customer service department. If you do have a question and you're not able to sign on to the account, you are free to call our customer service department. A representative is available from 8 a.m. to 8 p.m. And also, you can sign up to go paperless. Do away with snail mail and also the security of going paperless instead of having something lost in the mail. You can also go mobile. You can visit the App Store if you have an iPhone, or you can go to Google Play if you have anything other than an iPhone, and search for the Delta Dental app I always get tongue twisted with this. Search for the Delta Dental app by Delta Dental Plans Association. I'll say that one 10 times. Anyway, once you download the app and you're registered on our website, whatever you can see on your desktop computer, you will be able to see on your smartphone. You can find a dentist, your coverage details, again, an electronic ID card. However, it is not necessary for proof of eligibility, but if you feel more comfortable with one, it's right there in your hand. And you can also access the cost estimator tool. So no matter where you are, if you're not at home and can't access your desktop, you always have access through your smartphone. Okay, now I'm going to just share some of the value added features that's associated with your plan and you being enrolled in your plan. Visual dentistry. It is there's 2 visual dentistry options that you can use. You can use photo submission, or you can do a video visit. What are some of the advantages of virtual dentistry? You can check with your dentist for aftercare. That's one of the options that virtual dentistry is good for. Or if you need a second opinion, if you need emergency care, or just access to care, period. If you don't have time to go to visit a dentist within their working hours, you can do so through one of these virtual means. The virtual care is manned by Delta Dental dentists, and you can either see one video face-to-face anywhere, or you can submit a photo and you will get a response from a Delta Dental dentist in less than 24 hours. And it's also ideal for a quick exam or just an overall oral health evaluation. I do want to point out that with the photo submission, if you do need just a quick exam or an overall oral health evaluation, it is not used against your frequency limitations on your plan. Brush Smart. Brush Smart is another free oral wellness program just for our Delta Dental members. You'll have instant access to special offers, and we have partnered with Equip, Oral-B, Sonicare, where you can receive discounts or free shipping. You do have to sign up to receive these benefits, and you simply go to brushsmart.org and complete the sign-up process. You'll also have access to hearing aids and LASIK discounts. Again, Delta Dental has partnered with Amplifon Hearing Healthcare. The average person sees 62% savings off of retail hearing aid pricing. QualSight, you can receive up to 40 to 50% off of traditional LASIK eye surgery. To access these discounts, you simply call the 800 number that's provided. You will get a customer service representative that will walk you through the process. Okay, we also have savings, and these are savings to smile about. You'll have discounts and offers just by being a Delta Dental member. Oral health, discounts to help keep your oral health on track. Health and wellness, you can get discounts for fitness equipment, gym memberships, and more. Lifestyle, okay, you can actually receive discounts on services ranging from pet insurance to childcare and travel to financial and auto services. Travel and entertainment, you can receive discounts for movie theaters, theme parks, and possibly vacation planning and travel services. To learn more about this perk, go to lifeperksml.lifemart.com. You can learn more and then also register to receive the discounts. We also invite you to stay informed with our electronic magazine, Grin. This is a publication that will be emailed to you 4 times a year, and it does contain fun facts and answer some of your dental questions. If you need it in Spanish, we do provide it in Spanish. And each issue will have a very oral healthy recipe to share with you. So again, the member perks, you'll have access to the visual dentistry, Brush Smart, which that's savings on your home oral health care products, hearing aid and LASIK discounts, your life perks, which is discounts on products, services, and memberships, and also the wellness resources that you'll have access to online articles, recipes, videos, and more. You can also learn more about what your perks are by visiting this website, www.deltadentalins.com/member-perks. Okay, any questions?
Yes, there are quite a few questions.
Okay.
So let's see here. We have so we have a good amount of time for questions. So that's good because there's a lot up here.
Okay.
Okay, so how do I find out what plan I have and how do I change it? One way to find out which plan you have is by logging into your Acera account by going to acera.org/login, and you can see which healthcare plans you have. Otherwise, I'm sure you can contact Delta Dental and they'll tell you exactly which plans you have. And if you want to change plans, you're in luck because our open enrollment is coming up. November is Acera's open enrollment month each year, and this is your annual opportunity to add coverage, drop coverage, change plans. So you can do that during the month of November. There's instructions in the open enrollment packet that we mail out to you. If you want an electronic version of the open enrollment packet, you can simply go to acera.org/OE, and the OE stands for open enrollment. And then any changes you make become effective when the new plan year starts on February 1st. Do you have anything to add to that, Pat?
No, I don't.
Okay,
Thank you, Mike.
sure. Okay, next question. My long-term dentist has left Delta Dental. What are my options?
Okay, your options are to go to our website, deltadentalins.com, and choose another dentist. As I said earlier, you'll have the option of choosing from the PPO network, the Delta Dental PPO network, or the Delta Dental Premier Network. When you log on to our website, you'll see the link, Find a Dentist, and then that will take you to another link that you can choose Delta Dental PPO or Delta Dental Premier. You'll also see Delta Care USA. Disregard that. That is our dental HMO network. I would strongly recommend that you select Delta Dental PPO first because that's where you're going to see the most savings. And then it will ask you for the radius, the miles that you want to travel, and also your zip code. It will then bring up a list of dentists in our PPO network for you to choose from. That will include the hours for each dentist. It also includes, if it's a specialty or a general dentist. And it does include ratings for the dentist and what languages they speak. So it's a wealth of information and very easy to use, very user friendly.
Okay, great. Thank you.
Mhm.
And additionally, though, they would still have the option of continuing to visit their dentist that they've had for a long time, but then they would be paying the out-of-network prices for that. Is that right?
That's correct. That's correct.
And in some cases, the dentist won't do fill out the reimbursement forms. That'll be left up to you to submit reimbursement claims back to Delta Dental. Is that correct?
That is correct. If you go to a dentist in our network, they will submit the claims for you. If you choose to go out of network, it may be your responsibility to submit that claim. And the dentist may require payment in full upfront. If you go to a dentist in the network, they submit the claim. We pay them directly. The only thing that you would be responsible for is your cost share.
Great. And if you all want to see a visual representation of that, we do have a table in our retiree enrollment guide. We mailed you an open enrollment packet in early October. Some of you may have not received it yet. If you haven't received it yet, you can find an electronic copy of the entire open enrollment packet, including the retiree enrollment guide, by visiting acera.org/OE for open enrollment. If you just want to go straight to the guide, you can go to acera.org/guide and the enrollment guide will pop up. And there's a whole section on our dental benefits, and there's a comparison table that shows what the differences are between when you visit an in-network dentist, when you visit a premier dentist, and when you visit an out-of-network dentist. Okay, and then there is a comment about premier dentists. Someone is saying that their dentist of 25 years is a premier dentist, And this year, many of the dentists in their city are also premier dentists. And there is, it seems like more of a comment than a question, but there are a few differences between the PPO dentists and the premier dentists, correct?
That is correct. Mainly the difference is the reimbursement level. The dentist in our PPO network have agreed to accept less for their services. So that's going to mean less out of pocket for you for your cost share. It's also going to mean that you are going to stretch your maximum dollars. The premier dentists have agreed to receive a lesser amount for their services, just not as great as the PPO. So you will see a little bit more out of pocket expense for your cost share. And of course, your maximum dollars will go quicker. But you still see a savings than going out of network.
Okay. And they do have a follow-up comment regarding premier dentists, and I'll just share that comment with you offline, and we can get you a response to that, Janet,
Okay.
offline. Okay, so let's see. Next question. I usually use Sensodyne toothpaste, but it doesn't whiten the teeth. Would Colgate Optic Care whitening toothpaste cause my gums to be more sensitive?
Unfortunately, I don't have an answer for that. I would strongly recommend that you discuss that with your dentist, and your dentist will be able to direct you to the proper toothpaste to use based on your needs.
Yeah, that makes sense. Thanks.
Mhm.
Okay, next question. Does Delta Dental cover 4 cleanings per year for everyone, or only those with chronic conditions?
That is 4 cleanings per year for everyone.
Okay. Are you certain about that?
I will double check. Um, Let me double check and get back to you on that, Mike. I know
Okay.
some plans do cover the 4 cleanings per year, but I'll double check and get back to you on that.
Ish, do you know about that? I thought our plan was 2 cleanings, and then if you had a chronic condition, you could get additional cleanings under Smile Away.
Okay, that,
Yeah, yeah, yeah,
okay,
yeah. Our plan has 2 cleanings, and then the additional cleanings can be obtained if as long as they sign up through Smileway, and
okay.
and then they're looked at as far as what their condition is and so forth, and they can be provided additional cleanings.
Great, thanks. And then
Hmm?
as a follow-up question, that's a good segue into Smile Away. The Smile Away question, is there an additional fee for the Smile Away program if you qualify for it?
No, there is no additional fee.
Great. Okay, next question. Can you get Delta Dental if you aren't getting Acera healthcare? And by healthcare, I think I'm guessing that you mean medical insurance. And so I think the question is, if you don't take the medical insurance through Acera, can you still enroll in a Delta Dental plan? And the answer is absolutely yes. So it's your choice whether you want to enroll in a medical plan, a vision plan, or a dental plan with Acera, and you have that choice, and so you can decide what works for you in terms of enrolling in those types of plans.
Well, one correction, Mike. For medical, it's optional. Anybody can join in if they want to enroll into an Acera plan. For dental and vision,
That's right.
anybody who has 10 years or more of service are automatically placed onto the dental and vision, and Acera subsidizes the premium, so there's no cost to them. If they have a service connected disability, they're also placed on, and it's no cost. The only time there's a cost is if they add a dependent onto the plan, then their cost is what they cost to have the dependent. Anyone under 10 years of service, they can opt to enroll or not enroll. But if they choose to enroll into the dental or vision, they can do that. However, Acera doesn't subsidize towards the premium for those that are under 10 years of service. Okay.
Thanks for that, Ish.
You're welcome.
Okay, next question. Why is the maximum amount not equal to that from when I was working? Now that I'm on a fixed income, now is the time I really need the extra amount. Thanks for that question. And actually, this, as Pat was reporting in the presentation, for the 2024 plan year, Acera's board has increased the maximum for the Delta Dental PPO plan from $1,300 to $1,900 to match what most of the plans the county, the maximum for most of the plans that the county has made available. Now, it is possible there are a few groups in the county that might have a slightly higher maximum. And so that's something that we'll, keep tracking as over the next years. But for the 2024 plan year, Acera's plan maximum will match the county's, which is $1,900 for visiting any dentist, in-network, Premier, or out-of-network. Now, your $1,900 is going to go a lot farther if you visit in-network dentists. Okay. So next question, all PPO dentists. Okay, the question is, I think the question is, are all PPO dentists Premier dentists as well? So will they charge as a Premier dentist even though they're a PPO? And I don't think they will. The Premier dentists don't charge the same as the
No,
PPO
you will have dentists that are participating in both networks.
Okay.
If they are participating in both networks, they will charge at the PPO allowance, not the Premier allowance. The Premier network was actually our initial network. And about 25 years ago, that's when we started to develop the PPO network. So that's why you'll see some dentists in both networks.
Okay. And then there's two questions about a number. Somebody's asking for what was the phone number again? And then somebody else is asking for the Smile Away number. Are those two different numbers, or is that the same
Yes,
number?
they would be two different numbers. The Smile Away number is embedded in the presentation, and our customer service number is also in the presentation. That's the 888-335-8227.
Okay, 888-335-8227 is the customer service number, and I just typed that into the Q&A so you can all see it. Do you have the Smile Away number handy?
Unfortunately, Mike, I do not.
Okay, but if you call the regular customer service number, they can answer your questions about Smile Away.
Absolutely,
And connect you with Smile Away.
absolutely.
Okay. Next question, and let me just do a quick time check here. We have about let's see here. We have about 10 minutes left.
Mhm.
Okay, next question. If I have had cancer in the past but not currently, am I still eligible for the Smile Away program?
Yes, you will be.
Okay, great. That was an easy answer.
Mhm.
Next question. What is the link info for Delta Dental? Let's see here.
Are they referring to this slide where the members perk, where they can find out about the member perks?
Yeah, that could be it. So it looks
Okay.
like, yeah, it's yeah, you can see it up on the screen. The main webpage for Delta Dental is just www.deltadentalins.com.
That's correct.
Yeah. Okay, next question. Where do you find more information regarding Brush Smart?
And their Brush Smart, let me go back. Okay, you want to go to brushsmart.org.
Brushsmart.org.
Yep, that's where you go to sign up. And once you've signed up, then you'll have access to all the information. Or once again, if you need more information, or if you would like to have the information prior to signing up, call our customer service reps and they'll be able to assist you.
Great. Next question. My dentist is going out of network. They are claiming Delta Dental is lowering their reimbursement rates. Is this true?
I don't have access to that information, so I can't help you there. Again, reach out to customer service. I have not heard anything about reimbursements being lowered, so really can't help you there.
Okay, sorry about that. Sorry, I don't have an answer to your question. Next question, is this plan for age 62 or age 65? And I don't think there's an age limit on this plan, right?
Not on Delta's end.
Yeah.
You know, it's based on, you know, your eligibility requirements.
Yeah. So it's a plan for an Acera retiree at any age. Okay, so we answered that question already. Are the life perks available to all Delta Dental members? And perhaps that is the question could also be, is it for both of our plans, the PPO and Delta Care USA?
Okay, I know for this plan, the life perks is part of the plan.
The PPO?
The PPO, that's
Okay.
correct. I don't know if it's also part of the plan for your DHMO.
Okay.
Okay.
Okay. So there's a question. Unfortunately, they joined the presentation late. Is this information also available in the packet sent to you from Acera? Yes, there is an entire dental section in the retiree enrollment guide that is in your open enrollment packet. If you haven't yet received that in the mail, you can access the entire packet right now by visiting acera.org/OE. Or you can go straight to the enrollment guide, the retiree enrollment guide, by visiting acera.org/guide, and I'll put those links in the Q&A. And additionally, the presentation slides are available out on our health fair page at acera.org/health fair, and they're up there right now under Delta Dental. And additionally, we will be editing this video and posting it out on that health fair page by mid next week. It takes us a little while to edit these together. Okay. There is a comment. It says, watch out, people. Visiting an out-of-network dentist is expensive. They had a recent cleaning, exam, and x-rays resulted in having to pay $270. Whereas in network, it would have been a lot cheaper, is the comment.
And
So thanks for that
yeah,
comment.
thank you for sharing that. That goes back to earlier when I stressed the fact that, and in fact, I use the routine cleanings and exams, that even though your benefit pays at 100%, if you go out of network, that out of network dentist can balance bill you. And that's a great example. Thank you so much, whoever shared that. Thank you.
Yeah, thank you so much.
Mhm.
Okay, next question. I'm a type 2 diabetic. Does that alone qualify me for the 4 dental visits per year? And I think that is a SmileWay question.
Yes, and that is one of the diseases that would fall under the SmileWay benefit is diabetes.
Okay, thanks.
Mhm.
Next question. I have osteoporosis and was told to take Fosamax. However, I've heard from several dentists that Fosamax can cause jaw problems and prevent healing if you have a tooth pulled. Do you have an opinion on this?
I have no opinion. There again, that is that is a question that you do have to discuss with your dentist and also your primary care doctor.
Yeah, that makes sense. Yeah, sorry, we're not medical, we're not physicians, so
Right.
yeah. Okay, next question. We have about 3 minutes left for questions. What is the enrollee ID for Delta Dental?
The enrollee ID is going to be your social security number.
Okay.
So if you're going online, to register on our website, or if you call our customer service staff and they ask for your ID, it's going to be your social security number.
Okay, great. Next question. If I already enrolled in the SmileWay program last year, should I enroll again?
No, if you're not changing any benefits, if you're staying within the same plan, not making any plan changes, it will automatically roll over as of February 1st of 2024.
Okay, that's great. That makes it nice and easy.
Mm-hmm.
Next question. Why don't they pay the full cost of cleaning for a Premier dentist? This is a preventative service.
Based on, I would double check if the dentist is still in the Premier network, because it should cover for a routine cleaning and exam, unless there was other services provided that may not be a covered service. But I would call customer service or look at your EOB, your explanation of benefits, and see why it wasn't covered at 100%. But the PPO dentists, for those services, the PPO dentists are going to be reimbursed at the PPO allowance, which they're contracted for. Premier dentists are going to be reimbursed at the Premier allowance. So without looking further, I don't know why you were charged. Again, look at your EOB and call customer service, and they'll be able to walk you through the steps.
Okay, there's a couple of questions about how do I sign up for SmileWay, or how do I get more than 2 cleanings per year? So could you go over that again, like what the conditions are that get you the extra cleanings, and then
Sure,
who to
I will
contact
go.
about that?
Okay, if you have chronic conditions, and the chronic conditions are ALS, cancer, chronic kidney disease. If you're diabetic, or if you have heart disease, HIV or AIDS, Huntington's disease, if you've had joint replacement, or if you've been diagnosed with lupus, or opioid misuse and addiction, Parkinson's disease, rheumatoid arthritis, Sjögren's syndrome, or if you've had a stroke, you are eligible for additional coverage and that would be the 4 cleanings and gum maintenance per year, and also 1 scaling and root planing procedure would be covered at 100% per quadrant per year. You do need to enroll, and you can enroll in the SmileWay program by calling our customer service number.
Great. Yeah, that was a question a bunch of people had, is do I need to do anything? And yes, you do need to
Yes, you
enroll
do. You do
calling the
need
customer
to
service
call
number.
in. Mhm.
Okay. Well, those are all the questions we have time for. I'm sorry we weren't able to get to the rest of the questions. After the health fair, we'll go back through them and see if there are questions that we need to contact people individually about. But I just want to say thank you so much, Pat, for joining us. The benefits are amazing. We really appreciate your presentation, and we're so happy you could join us.
And thank you so much for having me. And most of all, thank you so much for selecting Delta Dental as your dental insurance provider. We do appreciate each and every one of you.
Absolutely. Thank you so much.
Mhm.